Welcome back to Smitty's Learning Room. Today we're going to have a look at how are priority issues for Australia's health identified. And we're just going to have a look at a bit of the background information that's going to be able to help us critique the use of epidemiology in relation to having a look at what can it tell us and who uses the measures of epidemiology and do they actually measure everything about health status. So if you remember from last time, epidemiology is the study of disease in groups or populations by collecting data and information which enables us to identify patterns and causes of such diseases. Epidemiology is a really effective way to measure health status, but sometimes has its limitations. When we talk about limitations, we're talking about things that we can't find out from the data. So the data doesn't necessarily tell us everything. For example, the data does not always show the significant variations in the health status amongst population subgroups, for example between Aboriginal and non-Aboriginal Australians. The statistics also tell us little about the degree and impact of illness. So for example, we might not be able to accurately indicate the quality of life for some people in relation to their level of distress, impairment, disability or handicap. Epidemiology can sometimes struggle to provide us with the whole health picture. Data on some areas, such as mental health, are incomplete or non-existent. The data also fails to explain why health inequities persist, and they also don't account for health determinants, so for example the social, economic, environmental and cultural factors that shape health. Some examples of where the data is collected from are medical research councils, Australian Bureau of Statistics, government departments, Workplace Safety Australia, National Heart Foundation and Roads and Traffic Authority. Now, national governments, groups, communities use this data to try and work out the inequities that exist in health and help us to identify health priority issues. Now remember that health priority issues are those health issues that are greatest concern to the governments and support organisations due to the effect they have on the overall health of Australians and the burden of health on the community.